Dr. Piskin, you talked about a very wonderful little machine called Diagonal Dent, which apparently detects anything wrong in the tooth, cavities and stuff, way before, even with the old methods of doing dentistry, x-rays and looking at it and having a magnifying glass, whatever it is you dentists do to see things which we don't see with the naked eye. And this machine apparently detects things even faster, which means, of course, less problem. Could you tell us a little bit about it and maybe even show us that thing?
Sure, I have one right in front of me here. The Diagonal Dent is actually a laser detector. And it has an LCD reading on it, and there's a little tip, and it has a little light at the end of the tip here. You can see the tip. And basically we just put that on the tooth, and in the grooves and the deep nooks and crannies of any tooth, and it'll give you a reading here. And if it gets to a certain number, like over 20, it's telling you that there is a cavity brewing, and most of the time you can't see it or feel it. You can't see it on an x-ray yet. You can't feel it with your instrument. But this will tell you beforehand so that you can clean it and seal it and do more of a preventative program. No anesthesia, no needles are needed to do any of this. They don't have to be numb. And we do it all the time, checking the teeth, and it never fails. Sometimes I'll say to my hygienist, there's no way that's a cavity. It has a high reading, 30, 40. I'm like, it can't be. I'll go in, I'll clean it out. Sure enough, there's a cavity there that I could not see or feel, and we prevented that tooth from being uncomfortable for the patient, the cavity spreading to a larger part of the tooth. Let's say we might not see them for another 6 months. We're catching it early. We're not letting it fester and letting that bacteria do its damage to the tooth structure. So this is called the Diagonal Dent helmet. It's a great device. We have a couple here in the office.
Wonderful. Well, that must be pretty good for, younger people, when they get their second, their stable, their regular teeth, quite often.
Yeah, the first and second molars.
Yeah, quite often you guys put sealants on it because, those teeth are still rather fragile for, cavities. And if there is such a tiny dinky thing in it which you guys couldn't see, and you put a sealant on it, you really capture it in it. The sealant is on it, but the devil was already in it. It's kind of, closing the barn door after the fox got, it's the other way around, but it's the same principle. With this thing, you would prevent that, and you would never, once you put that sealant on, there was nothing in it. You don't have to hope that there was nothing in it.
That's so true. There were times where we thought there was nothing going on, and we just seal it up, and years later, all of a sudden they come back and there's a cavity underneath the seal, and you go, how did that get there? It was there. It was never diagnosed because we didn't have the right tools. This is the right tool to use, and that doesn't happen anymore in my office. We check them all out before we even put sealants on. So it's a lot of fun, and we have the patient hold it. We explain it to them. The kids hold it. They watch the numbers. We write down the numbers for each tooth, and then the next time they come in, if it was a 15 last time and now it's still a 15, okay, we'll continue to watch. But all of a sudden it spikes up to a 30 or 40 number on the Diagonal Dent. We know that there's something that has to be addressed right away. So it's a great device. We're very excited about using it.
Prevention at its best. Thank you very much, Dr. Piskin. Bye-bye.
You're welcome. Bye-bye.